7.1 Introduction. Dr. Anjali was a forensic psychologist and a friend of Dr. Mahima, who was an academic counselor of IGNOU. Dr. Mahima had referred a learner, Pooja, from psychology program of IGNOU to carry out a small assignment on police psychology. Let us look at the conversation between Dr. Anjali and the learner Pooja. Pooja: Good morning ma'am. Dr. Anjali: Good morning. How may I help you? Pooja: Ma'am, I am a learner of IGNOU and Dr. Mahima has referred me to you. Dr. Anjali: Oh yes, you have to write an assignment on police psychology, right? Pooja: Yes ma'am. Dr. Anjali: So Pooja, why did you select an assignment on police psychology? Pooja: Actually ma'am, we were studying various subspecialities in forensic psychology and Dr. Mahima asked each of us to make an assignment on the subspecialities in forensic psychology and I chose police psychology as I felt it would be interesting. Dr. Anjali: So what idea do you have about police psychology? Pooja: Pooja: Ma'am, I think it has to do with police and since we call it police psychology, probably there is application of basic concepts and principles of psychology to police and policing. Dr. Anjali: That's right Pooja. Police psychologists apply their knowledge of science and psychology mainly to pre-employment assessments of prospective candidates to the police force, fitness for duty evaluations, clinical interventions, operational support and organizational consultation. Pooja: Okay ma'am, that makes the concept pretty clear. But ma'am, do police psychologists study mental health of police as well? Dr. Anjali: Yes Pooja, we know that a job of a police could be very stressful, they experience a lot of work pressure and police psychologists could play a role in providing interventions for stress management and also to promote positive mental health. Pooja had many such questions in her mind that she wanted to ask Dr. Anjali and she continued with her interaction on the topic. Block 3 of this course mainly focuses on police, investigation and correctional psychology. And in the very first unit of this block, that is, Unit 7, we will discuss about police psychology. Other related aspects such as police stress and police and human relations will also be discussed. 7.2 Police Psychology, an Introduction. American Psychology Association has defined police psychology as psychology applied to policing. It is defined as the application of psychological principles and methods to law enforcement. The functions of police psychologist have been given by APA as consisting of screening and hiring police officers, conducting screening for special squad, evaluation of police personnel for mental and physical fitness to join duty, where people have been taken on hostage, police psychologists carry on hostage negotiations, conducting training programs in large number of areas for the police personnel as for example training in motivation, human relations, stress management etc. In addition, police psychologist also takes up consultation and stress counseling of the police personnel. Police psychologist needs to have special knowledge about policing and many functions and organizations of police in a society. A police psychologist understands the goals of police and help and assist them to achieve the same. Since police has its important function to ensure law enforcement, police psychology helps and assists in this aspect in a big way. Towards this goal, police psychologists need to have a thorough knowledge of police personality, the stresses and the trauma they undergo, their working environment and various other problems they face in their functioning, in addition to working out a plan of treatment intervention to help the police personnel overcome their trauma and the post-traumatic stress disorder which is reported by police personnel as a result of their risky and dangerous work. Also, police psychologists are used for research, consultation and training programs, as they are proficient in experimental, social, Industrial and organizational psychology. In the beginning, when clinical psychologists were employed in police settings, they mainly evaluated the police applicants in terms of their fitness suitability for police job at different levels. However, as the work of police psychologists expanded, they started being involved in training officers at different levels, and in quite a few situations they were also the task of educating the police officers and police personnel. The police psychologists apply their knowledge of science and psychology mainly to pre-employment assessments of prospective candidates to the police force, fitness for duty evaluations, clinical interventions, operational support and organizational consultation. They may also apply behavioral intervention strategies including cognitive behavioral therapy, psychotherapy, behavior modification approaches, etc. In training, police psychologists also focus on how far the intervention has been effective and compare through research methods the prior status to crisis intervention and post-status intervention and evaluate the degree of improvement effected through intervention. There are many modalities of treatment available to police personnel that are imparted through training by police psychologists. Police psychologists use many treatment interventions such as the eye movement desensitization and reprocessing, EMDR, which is a form of psychotherapy in which the client or patient is made to recall images that are distressing to him/her. This therapy has been found to be very efficacious because of the best following reasons. 1. It is based on sound psychotherapy principles. 2. The client is facilitated indirectly by the therapist and if needed helps the client directly in the changing process, using a manualized set of rules. 3. The client decides how much to expose himself/herself to the traumatic memories so that he/she does not end up highly anxious or stressed out. 4. Further, the client decides and has also the freedom to share only that which he/she wants to share of the traumatic experience of the event or incident. 5. The therapy focuses on both emotions and bodily sensations related to the traumatic event and hence is able to help client progress in the positive direction. In the EMDR, the strategy used is approach strategy rather than avoidance strategy, and because of this, the client is able to reduce the anticipatory anxiety considerably, which arises due to feared memories. Police psychologists are also involved in evaluating police personnel before recruitment and again after recruitment to find out in which area the person will be most suitable, and the typical personality traits, the strengths and weaknesses of the person are all evaluated. Using screen out and select in process, the police psychologists not only reject certain candidates due to their personality and many defects and deficiencies, they also demonstrate the qualities and capabilities needed in different sections and areas of the police agency. To carry out evaluations accurately, the police psychologists use many test batteries and follow it up with interviews, etc. More commonly used test is the MMPI, Minnesota Multiphasic Personality Inventory, in addition to intelligence tests, other personality tests, situational tests, etc. Once the results are obtained, the same are linked to the job and the suitability of the personnel for the job is ascertained. These help the psychologist to clearly indicate the ability of the person to function on the different jobs assigned to the police personnel. To cite a few examples, the personnel may be evaluated if he/she uses drugs, whether he/she is punctual and not late for job, if he/she breaks rules and violates the police procedures, uses excessive force, etc. Police psychologists make use of projective tests like the Rorschach test and situational tests to ascertain the above aspects in the recruits and also use many of these tests for training purposes. Thus, the police psychologist very actively assist the law enforcement agencies and the police in particular in finding the right person to fit the job. The police work involves considerable danger, putting officers at risk, and therefore they require education and training. Police psychologists conduct training for the police personnel in how to negotiate hostage situations, job-related stress, as well as they are given training in the techniques involved in handling persons with mental illnesses, and are given training also in criminal investigation. 7.3 Police personality. The two important personality traits of police officers are social responsibility and conscientiousness. There is also another term, policeman's working personality, which explains how a police officer has to cope with risky tasks, dangerous assignments, risk of being isolated and the risk of being suspected, etc. They wield considerable authority and hence can take action that may be harsh and cruel too. This personality also includes the traditional values and patterns of behaviors expected of them and for which they are trained also. Thus, the police personality is the main component in the culture of police officers. More than anything, their main duty and goal is to save and preserve life of people. To attain this goal, the officer takes into consideration the behavior of the suspect and the criminal history of violence. They make use of their authority and even take drastic action like shooting, etc. if the situation demands. It may be mentioned here that the tasks and duties of the police officers involve high levels of stress and highly risky situations. They need to be extremely alert and take swift action and on the spot without delay, which may even result in heavy criticisms of the officers. These in turn may make them experience personal distress, mood change, and may affect adversely their psychological functioning. Police careers are such that at all levels of hierarchy in the police departments, many tend to develop such traits as cynicism, aloofness, suspiciousness, alienation, etc. in order to cope with the many risky and dangerous aspects of their career. They also suffer a great deal from many prejudices. They could have prejudice towards a certain group of people and as a result, they perceive this group as threatening, aggressive, violent and so on, and accordingly the police take action more on these assumptions than verifying the cause or gathering evidence regarding the crime and bring to book the real culprit. 7.4 Police stress. Before we go on to discuss police stress, let us look at some of the definitions of stress. Schaffer defined stress as arousal of mind and body in response to demands made on them. Lazarus and Folkman define stress as a particular relationship between the person and the environment that is appraised by the person as taxing or exceeding his /her resources and endangering his /her well-being. Trujillo et al. Defined stress as the body's reaction to a change that requires a physical, mental or emotional adjustment or response. This definition has further elaborated the response as being physical, mental or emotional in nature. The above definitions mainly highlight how stress can have an impact on the resources of an individual, which in turn can have a negative impact on his /her well-being. To discuss about police stress, it is well known that in their daily work and duty that the police are expected to accomplish, they face considerable problems, challenges and stresses of varied types. These in turn affect them adversely, causing both mental and physical health problems. Some of the major problems and difficulties they face in their occupation include the possibility of facing severe injuries that may handicap them for life or most of their life, fear of being killed while on duty, lack of recognition, poor equipments and gadgets, etc. More than these, some also have to deal with terrorists, such as anti-terrorist operations, drug lords and gangs, poor working conditions and heavy load of work, etc. Some may even face the situation of shooting someone in the line of duty and may feel guilty, and some others have to face the wrath of the public with regard to certain actions they have taken, Many do not. They may not get promotions on time and may have to obey persons at high or carry out certain orders even though they may consider them as incorrect. These add to enormous stress and often a certain degree of helplessness. Many suffer from lack of job satisfaction, low morale and frustration. Many do not find time to spend with their family, and in quite a few cases, due to the odd hours they keep and being called for duty at all odd hours, bring about strained relationship with their family members. Such stresses and lifestyle of the police personnel contribute to high rate of smoking and alcohol ingestion. Some research have shown that this occupational group die much earlier than all other groups because of the heavy stress they are subjected to. They suffer from high blood pressure, insomnia, heart problems and even PTSD, post-traumatic stress disorder. In one of the research studies on constables, occupational health problems were reported such as inadequate wages and facilities, duty at times continuously for 24 hours, having no time of their families, negative interaction with other police staff, suffer FOK negative public image etc. All these contribute to psychological stresses and burnout. It may be kept in mind that such occupational stress experienced by the police personnel would more often lead to impaired psychological and physical functioning. Furthermore, lack of encouragement, lack of recognition on the job, lack of holidays, lack of opportunities for promotion, inadequate salary, and delayed promotion etc. also cause considerable stress on the police personnel, especially at constable levels. Police personnel being a very important occupational group, it is very essential and urgent that their physical and mental health are given due consideration and every effort is put in to reduce the stresses, which includes stress management training for the police personnel, stress relief camps and yoga sessions. In addition, many other measures such as educating police regarding health issues, promoting health-related activities in the workplace, getting specialists to address the police personnel, conducting S-s etc. on positive health and how to remain physically and mentally healthy are all some of the innovative measures introduced to reduce and relieve the stress amongst these personnel. Another related aspect is the satisfaction and general positive feelings that are essential to reduce stress. Towards achieving this, the police needs to receive adequate and timely remuneration, decrease in number of hours of working so that they could spend relatively more time with their family. They also need enough opportunities to pursue higher education and develop higher level skills etc., which all will contribute to satisfaction with life to quite an extent. 7.5 Police and Human Relations. Historically, it is known that every country has been using instrument or agency in the form of police for enforcing law and order and protect its citizens. Police as perceived by the people in any society evokes awe, fear, feelings of protection and security and so on. Police, which has existed in every society, is expected to behave in a particular way and the people in the society expects typical pattern of action from this personnel. The kind of image people have of the police is important for the trust and confidence people have on this group. Only a favorable image of police would make people also have trust in them, thereby will be ready to cooperate and give their best to assist the police in maintaining law and order. However, in India, police are not very favorably considered and apart from cooperating with them, they are subjected to heavy criticism. The perception of police and policing in India has been very comprehensively brought out in a report in the year 2018. This report is based on a very comprehensive survey of 22 states of India published by the Centre for the Study of Developing Societies in collaboration with Common Cause. It is a study of performance of police and perception of people regarding the performance of police. A society expects the police to be responsible and take care of the security and safety needs of the society in addition to control crime. While doing so, it is expected that they would also treat people with dignity and respect. The survey found very few contact or interact with police, and amongst these there are more men than women who contact the police, the reason being the lack of gender-friendly atmosphere. As for registering of cases in the police station, people generally opine that many cases do not get registered, and as a result they do not get justice. Also, they perceive the reporting and recording of crime to be arbitrary. People fear the police, and thus victims do not approach the police to resolve their problem or even report a crime, etc. Another important aspect is that in India, the general opinion of the public about police is that they are unapproachable, biased, non-responsive and corrupt. This kind of negative perception about the police make people hesitate and deter them from approaching police even when in dire need. People's opinion and perception of police will be more favorable if only the police is ensuring their safety, reducing the crime rate and keeping people safe from attacks, assault, violence, crime, etc. It has been noted that during riots, disturbances and similar fear-arousing situations, the presence of police patrolling gives a sense of security and safety for people. The very presence of police patrolling in a certain locality creates feelings of safety and the general feeling that the criminals will not dare act in such conditions. Another factor is perception of police depends also on the satisfaction the people have in their functioning. If they are satisfied, their perception of police will also be positive. Going by that, they also will trust them. However, police extracting money, being corrupt, etc. have led to reduced or lack of trust amongst people in regard to the police. Thus, the perception of police being helpful, capable of protecting society, trustworthy, etc. depend a lot on the social identity, experience interacting with police and perceptions of police in terms of their attitude and functioning. While perception of the police by people in the community depends on a large number of factors, it is important to understand how people also perceive the discriminatory attitude of the police. One of the main complaints against the police is that they do not cater to the interests of common citizens and also show no accountability for whatever they are doing. Hence there is distrust and fear of the police in India. While fear of the police exists, quite a few prefer to approach the police when need arises, but at the same time they may not expect the police officers to give them a fair and just treatment. In addition to the above, it is also important to note that people in general find the police discriminating a great deal while dealing with crime, criminals and the public. The perception of people in regard to this is that the police discriminates between rich and poor, as well as in terms of caste, gender and religion. Discrimination by the police can be based on class, caste, religion, gender, educational level, occupation of the person, socio-economic status, etc. In addition, people fear the police and their excesses in treatment a great deal, and this is all the more so in the case of minority groups in India. Where people are perceiving discrimination, there the fear of police is also high. Higher the fear, more negative is the public perception of the police. Some of the factors that can be considered contributing to typical perception of the police include public accountability of police officers, crime reporting by the police and ensuring women and children's safety. By themselves also, police face considerable problems in day-to-day work life which affect their efficient performance adversely. These include apathy towards police by the citizens, financial problems and poorly trained in skills requiring police work, and so on. Police vehicles are fewer in number and hence face problems reaching crime spot on time, and the police do not have efficient network connections. As a result, they never receive information on time, nor are they able to direct and guide policemen at the spot, etc. where a crime had taken place. Despite these deficiencies, police work to their best ability but face quite a lot of stress and frustrations. Often people in the community are apathetic towards police and their functioning. Secondly, police may also feel that they need greater and continuous training so as to update their skills in many areas related to crime investigation. Though many training programs are conducted for the police personnel, these are not adequate and do not train the personnel in areas that are most essential. Further, the physical conditions in which police personnel are working is far from satisfactory. For instance, police stations may not have decent buildings and other infrastructure, and these in turn hamper their efficiency greatly. Police also require good vehicles that could reach them to the crime spots on time. Most police stations do not have adequate number of vehicles and also suffer from outdated equipments and outdated technology. They may also not have access to good forensic laboratories. Because of the above-mentioned problems, the efficient functioning of police get adversely affected. Police is a public institution and play a significant role in the democratic governance of the country. Thus, the focus needs to be not only on developing a positive perception of police amongst the general public but also on improving the relationship between the police and the community as a whole. In the United States of America, during President Obama's regime, a task force was appointed to identify best practices of policing and required the force to make recommendations to improve the training of police personnel, reduce police bias and work out strategies that could develop the trust of the community on the police. Some of the recommendations focused on the training and education of police officers, reducing their bias and instilling in them compassionate attitude towards the public in general and specifically towards the colored persons. The recommendation also pointed out the need for training the police officers in crisis intervention methods and techniques along with installing in them cultural sensitivity. In each of these areas and focus, police psychologists can play very significant role and contribute to improving police-community relationship. Some of the major aspects regarding this relationship are, for instance, 1. Research in regard to the bias of the police towards a certain group has to be carried out, particularly focusing on the brutal force used by the police, such as shooting by the police, systemic violence, etc. 2. Ideally there should be participation by the members of the community in research that focus on finding out the causes leading to death or trauma of a particular group, and where methods to improve police-community relations are topics of research. 3. One of the important aspects to be included in the training of police officers is to not only make them aware but instill in them what type of powerful impact that violence has on the individual, community and the society. 4. They should be trained to make use of psychological science to improve culturally competent community policing. 5. Funding should be made available for training in both behavioral and mental health treatment, so that police personnel become familiar with these issues and take due action when necessary. To conclude this section, the police in India face very difficult and complex issues. Their duties are clearly defined but they are unable to do their duty to the public's satisfaction as they come under numerous pressures. The training and education of the police need to be improved upon and they have to be sensitized to many problems in the society as well as to the needs of people in general and IANS. Police personnel work under restricted conditions, poor environment, poor working condition, long hours of duty without break. All these factors demotivate them and thus police in India is not as efficient and as effective as it is expected to be. 7.6 Police and Special Population. Special population refers to individuals with disabilities, individuals from economically disadvantaged families, including low-income youth and adults, persons involved in domestic violence, offenders and victims, persons with mental illness, juveniles, immigrants, etc. The definition of special population could vary across the different states in India. While police have multifarious tasks to accomplish, they have a special responsibility towards people who fall in the category of special population. These persons are handicapped in one way or the other, and their expectations and demands from the police are different from that of the general population. And they create unique situation for the police to handle. Special population also include persons with mental retardation, mentally ill persons, female inmates, mature elderly inmates, minorities and foreign inmates, youthful offenders, gangs, inmates in isolation, etc. Here we can also discuss about special offenders. Special offenders can also be criminal offenders with mental health problems. There can also be juvenile offenders, or sex offenders. As for police handling these special population, the first step is to recognize and deal with them in terms of the disability they suffer from. The police officer first finds out from the victim or the offender concerned if they suffer from any disability. It is not considered rude or offensive if the police officer asks such a question so as to help them with some special facilities. This will be appreciated by the victim rather than considering the same as offense. The next step is to interview as many persons as possible who are in one way or the other related to the offense, offender or the victim or all of these. The third step is to collate all the obtained information and identify suspect or suspects. The fourth step is to collect reliable and unshakable evidences in regard to the offense committed and the person concerned who committed the crime. The next step is to file the charges and carry on the procedure of arresting the culprit, etc. Domestic violence. These are crimes which quite often do not get reported for various reasons. However, the police has a special responsibility to handle these cases diligently and efficiently, thereby preventing such violence in the society. The police can play an important role here by showing extra attention and providing knowledge to the victims of domestic violence in regard to the various facilities and services available to them. Developmental disabilities. Another important special population is those who suffer from developmental disabilities. Because of the disability, these people are not considered capable of understanding what is happening, why they are to appear in the court, and many with this disability are also not fit to stand trial. In these cases, the police will have to take the help of mental health professionals, psychologists and others to ascertain the degree of disability and to understand the extent of disability they suffer from and decide, instead of imprisonment, if they could be sent for treatment to a hospital. Police thus play a different role in such cases. For all these, the police will have to produce clear evidence regarding the degree of disability in the individual and whether he/she could not even differentiate between right and wrong. To deal with this special population, the police needs to be trained. In particular, they should be given sensitivity training with reference to people with disabilities of varied types and how to deal with them and which are the professionals whose help they need to take, etc. Every effort should be put in by the police to help the special population, the accused and the victims, receive the justice, care and special attention they deserve. Programs have been developed for the police to identify and deal with immediately the violence perpetrated against a single individual or a group with disabilities. Police handling persons with mental illness. As for the police handling mentally ill persons, which is in the category of special population, it is the duty of the police to refer or even take persons to a hospital for psychiatric evaluation to ascertain whether the person is suffering from a mental disorder. The reason for doing so is the concerned individual may be a threat to himself or to others around him/her because of the disorder, which needs to be handled and treated by professional in an institution or a hospital. Generally, a family member or someone who has observed the person behaving oddly or strangely, or doing things that harm himself or others, can call police and inform them about such a person. On getting this information, the police reaches the designate place and takes charge of the person and takes appropriate action as needed. In India, as per the Mental Health Care Act, 2017, Section 100, the in charge of a police station has a duty towards the mentally ill person as reported by passerby, or by a neighbor or relative in the concerned police jurisdiction. The officer should take the individual, who suffers from mental illness and who is not in a position to take care of himself, under his protection with intimation to the mentally ill person's nearest relative, and take him /her to a hospital at the earliest for assessment of his health condition and treatment. The police officer should not arrest or lock up the person or take him /her into judicial or police custody under any circumstances. The public health institution /hospital in charge is responsible to assess and diagnose the case and make arrangements for the person's appropriate treatment. If the medical officer finds on assessment that the person has no mental illness, then he/she has to report this information to the police officer concerned. On the other hand, if the police finds a person behaving oddly and wandering about aimlessly, the same has to be reported to the family, which is to be traced by the police, and the family has to be informed about the whereabouts of the individual missing. According to the Section 101, if the police officer in charge of a police station comes to know of a person within his/her jurisdiction is suffering from mental illness and is also being treated in private or in public, being badly treated or is neglected, etc., the officer should immediately report the fact to the magistrate, within the jurisdiction in which the mentally ill person resides. According to Section 102 of the Mental Health Care Act 2017, if the mentally ill person is brought before the magistrate, the latter may order in writing that the mentally ill person may be sent to a hospital or health institution for assessment, and if found to suffer from a mental disorder, the hospital/institution can take the responsibility for starting treatment to help the person overcome his illness and keep him/her in the hospital for not more than 10 days. After the assessment and treatment, the medical officer has to send a report to the magistrate, who will then pass order based on the report. Thus, the role and function of police officer in the case of special population is a challenging one, and unless there is a continuous and regular as well as systematic training program to sensitize these officers, the special population may face difficulties in getting the due justice which is fair and equitable. Unless there is certain degree of independence, freedom and autonomy to take decisions and actions as the situation demands, it would be very difficult for the police to function effectively. It is important that police are independent, and at the same time they must ensure that their department or agency is accountable to the public, who provide resource allocation, financial assistance, and establish policies and procedures to follow. The police need to balance independence and autonomy with accountability. Police is accountable in regard to political accountability, legal accountability, administrative accountability, community policing, and providing unshakable evidence in the court of law which should not get dismissed by the judge as inadmissible. Thus, attempts need to be made to improve the relationship between the police and the public by taking measures such as promoting positive contacts of the public with police through Residential Welfare Association, RWA, and other people's organizations, reducing the negative encounters of the public with the police and ensuring greater accountability of the police personnel, thereby ensuring impartial inquiry. 7.7 Let us sum up. To summarize, the present unit focused on police psychology. American Psychology Association has defined police psychology as psychology applied to policing. It is defined as the application of psychological principles and methods to law enforcement. The police psychologists apply their knowledge of science and psychology mainly to pre-employment assessments of prospective candidates to the police force, fitness for duty evaluations, clinical interventions, operational support and organizational consultation. The unit also discussed about police personality. In this context, it was mentioned that the two important personality traits of police officers are social responsibility and conscientiousness. Further, the unit also focused on police stress and the police and human relations. In the context of police and human relations, the perception of police by the community was also discussed. Lastly, the unit also explained police and special population.